And I thought, a vitamin is a vitamin, right? Like prescriptions. The generic brand is just as good as the brand name. Wrong. Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life. Reducing, trying different ones, not really knowing what vitamins are out there and what they do for me was the absolute wrong thing I could be doing. After bariatric surgery, you must take vitamins for the rest of your life. This is non-negotiable. In this video, we're going to answer the following questions. Why vitamins and minerals are essential after having bariatric surgery. What types of vitamins and minerals are required for each procedure. What to look for when buying vitamins and minerals. The signs and symptoms of vitamin and mineral deficiencies. And how much should you expect to pay monthly for vitamins after having bariatric surgery. Serious illness can result from non-compliance of your vitamin and mineral guidelines. Mood, energy, and focus can also suffer from a lack of proper vitamins after having bariatric surgery. Are you at the beginning of your surgery journey and you're struggling with taking those vitamins? Maybe they don't taste good. Maybe you kind of get the gag reflex or they smell really bad. Some of them really smell really bad. Or maybe you're further down on your journey and you're thinking, I'm feeling pretty good. Do I really need these vitamins? You know, when I was sleeved in early 2019, I was also told I needed to take a multivitamin for the rest of my life, a bariatric multivitamin. And I thought, yeah, okay, I get that, I guess. But we never really got into it. And they actually also sold their own brand of bariatric vitamins in the office. So I kind of thought, yeah, you just want me to buy your brand in your office. There actually was, I'm going to be honest with you, there actually was a time where I thought that. I was further down on my journey and I thought, I'm feeling good. I'm getting this. I don't really need to buy these vitamins or at least as many vitamins as they were telling me I needed to. But I found out I was wrong. And I'm here to tell you, please listen to what I have to say. So, when should you be concerned about vitamins? The real answer is before, during, and after. However, right after surgery is kind of a critical time to think about the following. For some of us, it lasts a couple days, for some of us, a couple weeks, for some of us, even up to 6 months. We're struggling, right? There's some nausea, we're having difficult time taking in the vitamins. We can't take all of the vitamins. We might even be vomiting, diarrhea. All those things are happening for some of us, and that impacts the vitamins. So we need to be really concerned at that time for sure. When some of us just kind of vomit often, or we develop food intolerances, or we just can't eat the amount that they're suggesting that we need to eat, that is when the absorption of our vitamins and minerals is really, really at a dangerous level. Excessive vomiting and diarrhea really will impact the absorption of vitamin and minerals as well as your medications. So the research shows for sleeve patients, we are at a risk for nutritional deficiencies such as iron, folate, vitamin D, and the B vitamins, especially vitamin B12. We are at a risk because due to the fact that our stomach has been made smaller, the acid production in our stomach has been altered, which may affect the absorption of these vitamins. Vitamin B1, known as thiamine, a deficiency in B1 can lead to a neurological disorder. A vitamin D deficiency is still the most common deficiency in people who've had the sleeve 5 years later. Why are vitamins and minerals so important? Bariatric surgery, I hope for you, is more than just losing weight. It's about becoming healthy. And a big part of that is improving your nutrition. Proper nutrition really isn't complicated. There are three main things that you need to always consider and be concerned about: hydration, water intake, macronutrients, and micronutrients. You're probably already tracking your water and your macronutrients, your carbs, protein, and fats. After surgery, you and your bariatric team and your doctor should be monitoring the micronutrients as well. Micronutrients is just another word for vitamins and minerals. They're called micronutrients because compared to macronutrients, those carbs, protein, and fats, which we need large quantities of, the micronutrients are less. We don't need as much of, but just as important. The real fact is, the fact that we need to remember is it's hard enough to get everything we need into our body with a normal digestive system. After bariatric surgery, that's even more difficult. And let's be honest, our lifestyle leading up to surgery, most of us were already deficient in vitamins and minerals. If you've had gastric sleeve surgery, you just don't have capacity in your surgically altered stomach to consume enough food to get those accurate and adequate micronutrients. Our digestive enzymes may have been reduced, which alters or limits the breakdown of that food as it passes through the digestive tract. If you've had gastric bypass surgery, you've got capacity issues alongside those malabsorption issues. Because of the surgical changes to your digestive tract, your body just can't extract the nutrients it needs from your meals. This is even more important if you had the DSS procedure. Most bariatric programs, practices, surgeons are asking us to take multiple supplements each day and to follow up with blood work to determine if there are deficiencies. There are more than a dozen micronutrients that we need in our body to stay healthy. For most of these, you just need a trace amount. Others, such as B vitamins, folate, iron, and vitamin D, require more and more likely to come up short, or maybe deficient when we have blood work. And now, research, more and more optometrists are really seeing the relationship between bariatric surgery and vision problems. Here are a few to look out for no matter what bariatric surgery you had. Thiamine, aka B1, helps to convert food into energy and contributes to healthy skin, hair, and the liver. Early signs of thiamine deficiency can include fatigue, irritability, uneven sleep patterns, and abdominal discomfort, all which are pretty common, especially after surgery for many of us. So it's easy to write them off as nothing serious, but if we ignore them long enough, things can get much worse. We also need to consider the supplements that we need to protect our eyes. Taking in too little of vitamin A, particularly, could in some cases cause night blindness, dry eyes, ulcers, and in extreme cases, blindness. Vitamin B12 helps the body manufacture new red blood cells and contributes to a healthy central nervous system. A small B12 deficiency can have actually no symptoms at all, but untreated, it can lead to a general feeling of lightheadedness, weakness, muscle tingling, and more. Iron deficiency is commonly, in the United States anyways, a common deficiency, even more with bariatric patients. Early signs of iron deficiency can be fatigue again, lightheadedness, dizziness, a fast heart rate or even heart palpitations, or even brittle nails, just to mention a few. We've been told, or maybe you haven't heard this before, but calcium and vitamin D go hand in hand because generally we get them both from dairy products. The sun is also a major great source of vitamin D, but many of us live in cold climates or we're told to cover ourselves up in the sun. Many of us have body insecurities and we just don't show our skin to the sunlight, or it's just not easy to get to the sun. But Greek yogurt is not going to get the job done. A calcium deficiency can show up as confusion, memory loss, muscle spasms, numbness, tingling, and more. Early signs of vitamin D deficiencies can include bone pain and muscle weakness, also easily ignored by bariatric patients, as we are already kind of experiencing some of those, especially early post-op. As you just heard, a lot of these have overlapping symptoms of the deficiency. It's really not a question about if you should be taking supplements. It's about which supplements to take and how often. The most common supplements post-op are multivitamins. They're probably telling you a bariatric multivitamin, vitamin D, calcium, iron, and vitamin B12. So I just talked about some vitamins that generally most bariatric programs suggest that we need to take post surgery. But there might be additional ones, additional supplementation that you might need to take. But really, it comes down to we're all unique. Our histories are different. Our medical conditions are different. And the only way you can tell if you're deficient is having consistent and accurate and comprehensive blood work done. Typically, most programs require blood work to be done every 3 months until a year, and then annually after that. I'm going to tell you in a moment why I do blood work consistently every 3 months. And actually, I ask for extra blood work because I want to know what I'm deficient in and what I'm not deficient in. And I realize, and I have to explain it a lot of times to my doctor, that this is what I want because I'm being very super conscious of what I am being deficient in or not being deficient in. I have to remind my doctor sometimes that I did have bariatric surgery. I just want to know, and it's the only way you can really, really know if you are deficient and to get on top of that. So I do blood work every 3 months. So before just listening to this and you quickly jump into the car and drive to your local pharmacy and you stock up on all the vitamins, you really need to know what type of vitamins to buy. Not all vitamins are created equal. Please hear me. Not all vitamins are created equal. So let's start with some guidelines of what not to take. Don't take gummy vitamins. They're full of sugar and full of gumming agents, which is probably doing nothing for you, if not causing more problems for you. Avoid children's vitamins. They're just incomplete. Consider additional supplementation, especially if your lab work is telling you so. Maybe that all-in-one multivitamin is just not enough, and you might have to additional supplement. Many cheaper brands just have fillers in it or agents that you do not want to be ingesting, as well as they probably do not have the dosage that you need or you're required to have as a bariatric patient. Depending on the brand and the size of the vitamin, most likely you're going to need to take 1 to 4 multivitamins a day. You really need to check the bottle, check the back to see how many do you need to take to equal the dosage that they're requiring you to take. Now, the next guidelines are just general. They're just general. It'll all depend on your blood work and what you need. You might need more than this. You might need less than this, but typically you probably won't. You'll probably need more, but this is just a general overview when you're looking for your multivitamin. It should contain at least 18 mgs of iron. If you choose a multivitamin without iron, you'll need to kind of additionally supplement for that iron. There's multivitamins out there, even bariatric ones, with or without iron. Iron can cause constipation, and your surgeon or your dietitian may have to have a conversation with you about if you need iron or not. Postmenopausal women typically do not need additional iron. It should contain at least 400 mcgs of folic acid, and it should include at least 200% of the recommended daily intake for most, if not all, of the vitamins and minerals listed. Should contain at least 2 mgs of copper, should contain at least 12 mgs of thiamine B1, and at least, you can go higher, 3,000 IUs of vitamin D. Many of us need extra B12, so choosing your B12 vitamin. At least 500 mcg of B12 daily. Most B12 vitamins that we take, it's either chewable or you put them underneath your mouth and they melt. Now, some bariatric multivitamins might have enough B12 in them, and so you don't need additional B12 supplementation, but you have to have a conversation with your surgeon, or you need to know what you're taking and how much is in whatever you're taking. That's why it's super important. You have to read the label. 1,500 mg per day is required. For best absorption, 500, you kind of have to break up that 1,500. 500 should be taken at breakfast, maybe 500 at lunch, and then 500 at dinner. It should be taken within 2 hours of your iron. Do not take calcium and iron together. It'll just cancel each other out. Calcium inhibits the absorption of iron. Calcium citrate is what is recommended, not calcium carbonate. Absorption is better compared to the calcium carbonate. But you'll notice, I think calcium carbonate is cheaper, so you have to look at your ingredients, and they probably use that instead of calcium citrate. But when it comes to calcium, something to consider, more isn't better. It's actually possible to have too much of a good thing. Calcium can build up in unhealthy ways in your bloodstream, and this hypercalcemia can cause a variety of other problems ranging from small to great and serious. But don't toss out your calcium supplements just quite yet. This is why it's super important to have these conversations with your bariatric surgeons and your doctors, because soaring calcium levels can be triggered by other diseases, including parathyroid and some of the cancers. Hypercalcemia can also be a side effect of some medication. So considering that, those over-the-counter calcium supplementation can maybe push you over the edge. Too much of a good thing. And it is kind of surprisingly easy to kind of overdo it with calcium, especially if you consume a lot of dairy or you're using a lot of that anti-acid chews like Tums, because some of those have calcium in them as well. On top of all that, higher levels of vitamin A and vitamin D can also make calcium rise. Vitamin C can help with the absorption of iron. When choosing a vitamin and mineral supplement after having bariatric surgery, consider the following. Does this vitamin meet my needs? My needs. There are a lot of different formulations. A lot of bariatric surgeons or even our nutritionists or dietitians don't explain this enough, and this is super important. Understanding the difference between fat-soluble vitamins and water-soluble vitamins. The way your body absorbs different vitamins plays a large role in both the safety and the absorption of those vitamins. The majority of the vitamins are water-soluble, most of them being all the B vitamins and vitamin C. Any excess of water-soluble vitamins will be excreted through the urination process. So when you pee, if there's any excess, don't have to worry. It's going to be released when you go to the bathroom. There are 4 fat-soluble vitamins. These vitamins are absorbed by the fat globules in our bloodstream and are carried throughout our bloodstream. Vitamin A, vitamin D, vitamin E, and vitamin K. That's why a lot of times you'll see vitamin D3. It's a combination of vitamin D and vitamin A, vitamin K, and vitamin E, because they're all fat soluble. So if you are really concerned about that, as you should be kind of concerned about that, is I would always recommend take a vitamin D3 versus just a vitamin D. So unlike water-soluble vitamins, fat-soluble vitamins don't immediately leave the body. Instead, they're stored in the liver or fatty tissue for later use. So water-soluble, there's a very unlikely chance that they will get to excess or be stored in your body and cause trouble for you. Any excess exits when we pee. But because of that, you need to consistently get them into your system. Fat-soluble will be stored. So excess is more likely with fat-soluble. And that's not necessarily a good thing. Another reason why you need to stick with recommended guidelines and really know what are you deficient in, what are you not deficient in, and the myth that more is better. So how many do I need to take? As we talked about, it depends on the guidelines, the label, but a lot of us, we're taking multiple supplements each day. And that can be kind of difficult for some of us. So if you're consistent and you're kind of a person who's detail orientated, you've got maybe some tricks and tips that lets you know this is each time I need to take my vitamins. But for some of us, remembering is just difficult for us. There are, in some situations, kind of that one big pill that has a mega dose in it that meets our requirements. That might be an option, but for especially for the people that just can't remember to take it multiple times throughout the day. But remember, that will be a bigger pill to take. And the bigger pill, the one pill options, usually are not absorbed as well as breaking up the times and taking it multiple times a day. Then there's the concern for some of us that just cannot take orally pills or even chewables. So you need to ask myself, can I take a chewable? Can I take a pill? Can I take a capsule? Or do I have to consider other options such as drinkable vitamins, so liquid vitamins? There's patch vitamins, and there's also injectable vitamins. I get it. Swallowing pills, especially really right after bariatric surgery, is super difficult, if not impossible. That is the reason why a lot of bariatric programs will strongly suggest having a chewable vitamin, especially right after surgery. But even those, they can be chalky, they can be hard to swallow and ingest. There's all kinds of new products out there, especially as the bariatric surgery field gets bigger and bigger. There's all kinds of options out there. And I do encourage you to look into that. Have a conversation with your bariatric surgeon. Some programs don't believe in the other options. Some just want you to buy theirs. But there is other options out there, and that's why it's super important to get blood work done. Try some of these options. Make sure you're monitoring. Is this actually working for me? Just don't blindly believe. I'm going to tell you an example for me. I had my gallbladder out as well as being sleeved. So I knew that my liver was going to have to work a little bit harder because I don't have that gallbladder. So just to let you know, anything that we take in, especially with medications, supplementation, has to be, our liver has to take care of that. So I wanted to give my liver a break sometimes. So I really wanted to consider patch vitamins. I had a conversation with my bariatric surgeon. We agreed to try them. He believed in them, but we agreed to try them, but really be on top of my lab work. So I'm here to tell you that I've been doing it for 2 years now. This is the reason why I get my blood work done every 3 months, because I want to make sure that patch vitamins are working for me. Now, they don't work for everybody. Same with drinkable vitamins, don't work for everybody. So you have to have conversations with your team. You have to have that blood work done, and you have to be on top of it. Just don't assume that these things work for you and your body. It might not be. So, but there are options out there. And for some of us, we just cannot take those chewable or those big pills and capsules. So that shouldn't stop us, because we do need the vitamin and mineral supplementation for the rest of our lives. So we need to find a way. There's also injectables out there. Now, these are a lot more expensive. There's hydration clinics where you go, they can give you an IV bag full of vitamins, most likely with some saline solution. That's an option, but also there's injectable vitamins as well. Now, for a lot of us, I hate to say it, it comes down to price. Yes, bariatric vitamins generally are a lot more money. And then if we go with drinkable vitamins, other types of options, it could be a lot more expensive. So these are things you need to kind of look into. Maybe there's programs. I don't know. Maybe your insurance covers vitamins. Mine didn't. But there's all kinds of things to kind of look at. Sometimes pharmacies will have programs. Sometimes the actual vitamin company has memberships, or they have coupons or reduced rates or even sales. So it's always worth looking into that. Always ask yourself, is this a brand I can trust? Unlike medicines and even food, the FDA, the Food and Drug Administration, does not have to approve inspect vitamins and minerals sold in the United States. So, what does that mean? It means that anything goes out there when it comes to vitamins. That means there might be lower dosages. It might mean there's a lot of fillers. It might mean there is less quality of product used. It might mean they're not even telling you the truth. It might mean all that. It might not mean that, but you have to really do your due diligence and trust the brand that you are using, especially when it comes to supplementation, because this is for the rest of your life. Look for brands that are labeled NSF International, US Pharmacopoeia, Underwriters Laboratory, Consumer Lab Seal. These are third-party agencies testing to confirm that the supplements that they are saying are in these products, that they're being truthful and actually contain what they put on the label. Can I afford to take these vitamins for the rest of my life? I hate to say it, price is important. Try to always buy the best possible vitamin that you can afford. I recognize many patients are on fixed incomes and need to be very price aware. A typical multivitamin with additional calcium will usually cost between 50 and 70 US dollars per month. Now, depending on the brand, depending on your situation and the additional supplementation that you may need, it might be more than that. I get it, it's not cheap, but money well spent to ensure that you're healthy, happy, and have long-term success. As I mentioned, you should really plan on spending at least $50 a month on vitamins and supplementation. Sometimes it could be higher, and for some of us it is quite a bit higher. But we have undergone a major surgery, hopefully with the intention of getting healthy. So this is one of the ways, maybe even the most important way, to invest in yourself so that you can remain healthy. And a lot of us, like I mentioned, came into surgery being deficient already. Figuring out a schedule and sticking to it and finding a vitamin that works for you is the key to success. It's like breathing for me. It's non-negotiable. It's what I need to do every single day so that I can have long-term success and be as healthy as possible. Just important as the stuff that's in your vitamins is the stuff that's in your food. Check out this video to understand what's hidden in some of your food items as well.